Approve.
So moved.
Okay, moved by Sweeney, seconded by Turner. All in favor, please say aye.
Aye.
All right. Madam Clerk, if you could read the first item into the record, please.
Resolution 2021-0293, authorizing contract number 1974 with Case Western Reserve University in the amount not to exceed $1,500,000 for fiscal agent and program operator services for the First Year Cleveland Initiative to reduce the infant mortality rates in Cuyahoga County for the period January 1st, 2022 to December 31st, 2024.
All right, thank you. Who is presenting today? Please state your name for the record.
Good afternoon, David Merriman, Director of Health and Human Services. There are a number of items today that we will be presenting. I believe up first will be Sabrina Roberts on behalf of our Office of Health Policy. Cindy Weisgettel will be presenting on the Division of Children and Family Service items, and Director Tracy Mason will be presenting on the master service agreements that she has today. Some of the directors will be moving on. I know there are some commitments that they have after their presentations. I'll be staying on for the remainder of the meeting, and I'm going to turn it over to Paul Porter, who will talk in detail about the specific projects. Paul?
Thanks, David. Paul Porter, Health and Human Services, Division of Contract Administration and Performance, on behalf of the Office of the Director and specifically the Division of Health Policy. This first item is an agreement for our annual funding support for the First Year Cleveland program. You may be familiar with previous agreements where we've typically done one-year increments of $500,000. At times that was in conjunction with the city of Cleveland. Looking through this amendment process last time we did it, when there was potentially some confusion about an amendment that had been put through and executed by the city of Cleveland, but didn't necessarily go through the county's approval process in the right channels. I worked with Director Merriman and with Sabrina Roberts, as well as the board and team involved with this contract, to see if we could do a multi-year agreement to get rid of the need to come back annually on it, as well as something that we could kind of do our own standalone agreement instead of having to go through both our approval process and the city of Cleveland's approval process. So the item that we're bringing forward keeps the same commitment from the county, a $500,000 a year, funding support agreement. And the agreement is with Case Western Reserve University, who's the current selected program operator and fiscal agent for the First Year Cleveland program. Because this is a multi-year agreement instead of just a single year agreement, we did make sure that the agreement itself reflects that if for some reason during that longer term, the 3-year term, First Year Cleveland's board would elect to switch to a different program operator or fiscal agent, this agreement does allow those dollars to transfer to any new operator or fiscal agent. It's not that, we're necessarily stuck with this particular operator or fiscal agent. I know that that was a question from some of the First Year Cleveland board members as we discussed switching from an annual agreement to a multi-year agreement. As David mentioned, Sabrina Roberts is here from the Department of Health and Human Services, as well as Catrice Kane, who's the Interim Executive Director for First Year Cleveland, and Dave Silvaggio, the Senior Director of Community Health Programs at Case Western Reserve University School of Medicine. I'm happy to answer any questions about the agreement itself. If you have any program-specific questions, I would defer to Sabrina, Catrice, and Dave for those.
All right. Open it up to any questions for Paul.
May I just make a comment?
Yes.
Thank you, Madam Chairwoman. Thank you for your presentation, but when you read the heading of the legislation, you see Case Western Reserve and you see First Year Cleveland in a partnership with Cuyahoga County. It's a good thing. So I'll be very supportive. Thank you.
Thank you, Councilman Sweeney.
All right. Any questions for any of the program? Councilman Miller.
Thank you, Madam Chair. And my question is whether we have any updates to the progress data on what degree of success we're having in reducing infant mortality rates.
Thank you, Councilman Miller. For that, I'll ask Sabrina and Catrice if you'd like to come up to address those questions.
Good afternoon. I'll let Catrice give you a brief overview. If you have any specific questions, I think she will answer it and give you an overview of how the numbers look from the last 3 years.
Sabrina, and good afternoon, everyone.
Good afternoon.
So since the work truly started at First Year Cleveland, since the work truly started with First Year Cleveland around 2016, progress has been made. I do want to comment on a few things on 2020 to 2021
Can you state your
data.
name for the record?
Oh, Catrice Kane, Interim Executive Director for First Year Cleveland. So we receive monthly infant mortality data and birth outcomes data from the Cuyahoga County Board of Health. So we appreciate that support, and we appreciate your continued support. In 2020, the overall infant mortality rate was 7.65, and this is the lowest infant mortality rate recorded in Cuyahoga County. In 2020, the county's Black infant mortality rate was 14.80, and this is the lowest Black infant mortality rate since the inception of First Year Cleveland in 2015. We do know that COVID did hit 2020, so we saw across the countries a decrease in premature births. For that reason, there are several indicators. We know that there are stimulus checks that could provide that financial support that the mothers and babies needed. We know that women were working from home, so that stress, especially around work environments, probably decreased and improved health outcomes for women and babies. We understand the impact that racism and toxic stress has on birth outcomes. So we know that being able in a nurturing environment in their home could have been one of the reasons for this decrease. Within 2021, this is preliminary and unaudited data. We know that the overall infant mortality rate is 7.18, so that is lower than 2020 data. The Black infant mortality rate is 11.47, which is also a decrease from 2020. The white infant mortality rate is 4.93. It was slightly uptick from 2020, but our efforts will continue to be in examining this data at the neighborhood level to make sure we have a clear understanding what's happening within our communities, that we're addressing the issues around racism and social determinants of health, and that we're working with our partners to understand what are the needs of our women and families, including fathers as well, and how we can continue to collectively address this issue specifically related to Black infant mortality rate. Although our numbers have decreased, we still have high rates of our babies dying in our communities. So we have to address the underlying factors and be very intentional in our efforts. So I'm glad of the direction of First Year Cleveland. We are in a transition, but with the support of our new 20-member board executive committee, co-chaired by City Council President Blaine Griffin and India Pierce-Lee from Cleveland Foundation. Sabrina Roberts is also on that executive committee. We are moving forward in the direction of continuing our healthcare approaches and programs and initiatives, as well as really focusing on community-led and community-based interventions.
Madam Chair.
You just answered one of my questions. I was going to say, what was the connection between the two? Yes, Councilman.
Just a comment, the initial report that I had was that the infant mortality rate overall went down, but the gap between white and African American had actually widened. But the 2021 data are very encouraging. You had an overall decrease, and most of the decrease was in the African American community. So we may be starting to make progress on equity as well. So I wish you continued success.
Thank you.
Any other questions for anyone? All right, hearing none, seeing none. Thank you both for coming down. Thank you, everyone that's coming down for this contract. Any questions for Paul, last round? All right. And so, Paul, this, I'm seeing, you said you were going to one-year contracts, but I'm seeing, no, you're leaving from a one-year contract, and, because the dates are 1/1/2022, and may I ask why we're a little behind on getting?
Correct. So this contract was actually introduced in December to county council, and I think it was just a matter of the holiday, there wasn't a second meeting in December, and then this is the first HHSA committee meeting since it was introduced. So had there been 2 December meetings, we would have been able to get it approved with the second reading suspension. Given that this is already past the 1/1 date, though, we would ask if we could do approval on second reading suspension.
Okay, that's right. You reminded me. So in terms of providers, it is the same one as we currently used last year?
Correct. The provider has not changed since the program's inception, I believe. And again, the only reason we wanted to make sure that language was included to allow for the potential change in provider is because this is a multi-year agreement instead of the typical annual agreement.
Okay. Well, thank you. I'll call for the vote for R20210293. Can I have a motion to move it forward under second reading suspension? And moved by Turner, seconded by Sweeney. All in favor, please say aye. Aye. Okay, second reading suspension.
Thank you.
All right, Madam Clerk, if you could read our next item into the record, please.
Resolution 2022-0024, making awards on requisition number 6408 to various providers in the total amount not to exceed $5,330,000 for family-centered support services for at-risk children and families for the period January 1st, 2022 to December 31st, 2023.
Madam Clerk, I'd like my name added to the first one. Anyone else wanted their name added for infant mortality?
Madam Chair, I will.
Right, all 4 of us. Thank you. Go ahead, Paul.
Good afternoon, Paul Porter again, Health and Human Services, this time on behalf of the Division of Children and Family Services, here for their Family-Centered Supportive Services contract. I'm joined by several representatives from the Division of Children and Family Services, including Director Cindy Weiskettle, Deputy Director Jackie Fletcher, and then Karen Storman, who's one of the managers that oversees the FCSS program. Additionally, we do have a representative from Applewood, Margot Williams. Applewood is one of the vendors under this contract. So if you have program-specific questions, I will defer to them on those. This is an RFP award for a master agreement that provides a menu of different services to help at-risk kids and their families avoid further intervention by DCFS. Services covered by the master agreement include high-fidelity wraparound services, family preservation, evidence-based programming, therapy, the Nurturing Parenting Education Program, supported visitation, medical case management, and newly added this year, the Youth Acceptance Project to work with the families of LGBTQ youth. That was previously a standalone program that was funded by a grant, and that grant has expired, so we're folding those services into this master agreement. Even though we no longer have the grant funding, that's been a great success story, and we have a commitment to continue that funding under this contract. This contract is for a 2-year period, 2022 and 2023. The RFP additionally allowed for an option year for funding in 2024. If we decide to exercise that option, it would come back to this committee as an amendment. We issued an RFP for these services and received 14 responses. We are making an award to 11 of those vendors. So there were 3 of the vendors that we opted not to make an award to. Many of them are the same vendors that we've had in the past. Some of them are new, and each vendor delivers a variety of services. I don't think there's any vendor on here that their menu of services is exactly the same. So in our award determinations, we tried to look at making sure all of the services have at least one vendor that can deliver those. Some of the services, depending on demand, might have more than one vendor that provides them, or we might have picked vendors that cover like a different geographical area or have kind of a specialization. I do want to note that the funding amount over 2 years is the same as what it was for the one-year agreement for 2021. So it's an annual dollar amount of approximately $2,665,000, and that's a not-to-exceed dollar amount. I'm happy to answer any questions you have about the contract award itself, and again, I'll defer to department staff and the vendor for any other questions you might have.
Paul, real quick, what was that dollar amount? Because we have the 2-year dollar amount here.
Sure. So the 2-year dollar amount is $5,330,000. That breaks down to an annual value of $2,665,000.
Thank you. All right, any questions for Paul? Councilman Miller?
Did I hear correctly that the annual amount is the same as what it's been?
Correct. The $2,665,000 is the same as the annual amount was in 2021, Councilman Miller.
And so since you added the new program, did that mean some other things had to get cut?
We did look, Councilman Miller, at the overall service delivery and utilization of different services. As everybody knows, we were still dealing with the pandemic in 2021, and that caused both, overutilization in some areas, underutilization in other areas. At this time, we were able to move forward with an award that still fits within that same dollar amount, and that did require some adjustment to some of the other services. But again, when we looked at, kind of balancing that budget, we looked at what demand for those specific services was to make sure that we could fit it in.
So I help manage 10 or so vendors for the Regional Child Abuse Prevention Council, and I see the same thing, so I know exactly what you're talking about. Thank you.
Thank you.
Councilman Sweeney?
Excuse me, Councilman Sweeney, your microphone.
Madam Chairwoman, just to follow up on my council colleagues' questions. You mentioned you had a budget, and then the pandemic hit, and some got more used and some got less used. Did you budget for this particular one for the pandemic snapshot now, or a budget for the pandemic's getting behind us?
Sure. So you're talking specifically for the Youth Acceptance Project, Councilman Sweeney. On that, I'd like to defer to maybe Jackie and Cindy about that specific one. Since this is a program that wasn't included in the master agreement, it was grant funded, and I know that we received some additional grant funding through that program. So it's something that has been utilized. That's why we made the decision to add this in. I don't know.
And this is just more curiosity.
Sure.
You guys are the pros at this stuff. I'm just trying to figure out. The snapshot in time is so hard to predict with the current set of circumstances. Just trying to understand what your thought process is. Thank you.
Good afternoon, Cindy Weiskettle for DCFS. The work we've done with the Youth Acceptance, as Paul said, was a grant. Some of that work has been brought in-house. Some of it has then gone to one of our providers to do. So a lot of the work resolves around safe identification when young people come out. Some of the work is around family acceptance. So what we find in child welfare, as they've studied it, when kids come out to their parents, sometimes they get put out. There's estimates that 30% or more of kids coming into custody as teenagers are young folks that have come out of their parents' house because they have come out somewhere along the LGBTQ continuum. So a lot of the work is around training our staff and helping our staff deal with a population of kids that have some different needs than some of our other kids.
Thank you. And just one other one, Paul, you said 3 didn't make the cut. Can you tell me which 3 didn't make the cut?
Correct. Hold on one moment. Let me pull out my spreadsheet here. I tried to have everything organized. So these were 3 vendors. One is Pinnacle, the other is Ace Wellness, and then Youth Village. And I want to take a look. Just run down my score sheet real quick and make sure I'm giving you an accurate portrayal. The vendors that we didn't make an award to, their scoring was, they were at the bottom of the
Yeah,
score.
and I'm just asking who they were, and through the chair, just one follow-up is, Did they participate in previous years as awarded vendors?
Sure, Councilman Sweeney, I believe those were all three not current vendors for the program. I believe they were new ones.
I am very happy that you give such great answers. Thank you.
Thank you.
Any other questions for Paul or the team that came out to share any of the programmatic questions? And the National Youth Advocate, are they here with us today?
National Youth Advocate Program is not here today, but Margot Williams is here from Applewood, and Applewood is one of the vendors for this specific master agreement, as well as for our out-of-home care master agreement, which will be presented later. If you'd like, I'm sure Margot may be happy to tell you a little bit about her perspective delivering services under the program.
Please.
Good afternoon.
State your name.
Margot
Thank you.
Williams, Applewood Centers.
All right, so if you could just give us, this is the LBGT youth?
No, ma'am. No.
It's not, that's the one I wanted to hear. I apologize.
I apologize, Councilwoman Conwell. Applewood is one of our vendors for other services. We don't have a representative for the Youth Acceptance Program. If there's any follow-up questions, we'd be happy to get answers for you on that, though.
All right. Well, thank you all for coming out in regards to this specific contract. I'll take a motion to move this to the full body under second reading suspension.
If we could, please.
Moved by Miller, seconded by Turner. All in favor to move this to the full council under second reading suspension, please say aye.
Aye.
All right. I looked at the date real quick, Paul.
Thank you, Councilwoman.
Madam Clerk, if you could read the next item into the record, please.
Resolution 2022-0025, making awards on requisition number 6690 to various municipalities and providers in the total amount not to exceed $7,138,350 for the Community Social Services Program for the period January 1st, 2022 to December 31st, 2023.
Good afternoon, Paul Porter, Health and Human Services, on behalf of the Division of Senior and Adult Services. This is a 2-year award on an RFP that was conducted for DSAS's Community Social Services Program, or CSSP. This is the funding that DSAS administers throughout the county for senior services through a variety of vendors that operate within distinct neighborhoods throughout the county. Again, this is an RFP award, so we conducted an RFP and sought vendors for the 2-year period covering 2022 and 2023. There is an option year contained in the RFP that we could exercise an amendment for funding in 2024. I do want to note, this is a program that has been a long-standing program at DSAS. We were just before the committee a few months ago for additional funds in the amount of $600,000 for service delivery during calendar year 2021. I won't go into all the detail about the exact services that are covered under this. I would refresh your memory that there were a lot of changes in service delivery by the vendors as a result of the pandemic, specifically adding home delivered meals as an option in addition to our typical congregate meals. This program is geared towards getting seniors out of their home and into the community. Obviously, the pandemic presents numerous challenges with that, not least of which the seniors being the most vulnerable population. So our vendors did a great job pivoting from an in-person service delivery model that was exclusively what it was prior to the pandemic to being able to pivot on the fly to a remote and in-home service delivery model, if you will. Some of the vendors, especially before the latest surge on the virus, had started to open back up. They've got people coming for some programs. Some of them have had congregate meals. Some of the vendors continue to deliver those remote services, the home delivered meals. And we do expect that that's not something that's going to go away right away. So those services were included in this RFP. We are working, and I know Councilman Miller heard this yesterday at the Board of Control. I presented or Monday, for an alternative procurement process to solicit additional RFPs for these services, or solicit additional proposals for these services. We have a couple of critical service gaps based on the awards that we're making right now. No center in the central neighborhood submitted a proposal, and we're underrepresented for services in Parma Heights. The Parma Heights Senior Center was a vendor under the program until the end of last year, and they did not submit a proposal. And those are a couple of critical areas where we know seniors need service. We've had clients in the past, so we are going back out to try and make sure we plug those service gaps. We would come back to either the Board of Control or Council with additional awards depending on the dollar amount. The reason we requested an alt procurement for that is so we can add the vendors into this master agreement. If we did a totally separate RFP, a new contract would have to come out of that RFP through the award process. By doing the alt procurement, we're able to add the vendors into this agreement by amendment once we make those award determinations. Additionally, so we are making awards to many different vendors, but there were a couple of agencies that submitted proposals specifically for digital literacy. They were good proposals, but when we looked at the funding that we had available and kind of some of the critical safety net services like the meals, like the transportation, and the activities that we typically fund, we weren't able to meet the needs of all the requested funds. I think the proposals that we got totaled almost $8.5 million. So we know that there's a gap out there and we weren't going to be able to fund all of that. But we decided not to make awards on digital literacy right now until we're able to get some additional funding available for that. We wanted to preserve some of those other critical services. There are some contracts that previously were standalone. So we had an exemption contract for Senior Transportation Connection, for instance, and we had an exemption contract for the Cleveland Clergy Alliance. We folded the funding for those services into this CSSP contract and included both a community outreach service, which is some of the services that are provided by the Clergy Alliance, and we have STC. They submitted a proposal under the transportation service type. So they're receiving funding through this contract. They've never been a vendor for CSSP before, and it's a little bit of kind of a new approach for us. Many of our vendors have used them as a subcontractor. This is the first time we're using them, with their own contract under this one. Additionally, DSAS is thrilled to be able to add LEAP, Linking Employment Ability and Potentials. Senior and Adult Services is focused not only on serving seniors, but also serving adults with disabilities. And previously, we haven't had a provider under this contract that focused exclusively on that disability population. Many of our vendors provide services to individuals with disabilities in addition to seniors, but it's great that we were able to get a proposal from them and make an award to add them to the agreement. I know that's a mouthful. I would like to note that several DSAS personnel are here. Administrator Tracy Mason, Executive Officer Pat Newell, Daphne James is here, and one of our vendors from Murtis Taylor, Lavelle Custard, is here as well, if you'd like to hear a bit more about the programmatic perspective from any of them.
All right. Paul, question for you. You mentioned LEAP was
Correct.
new. Who else was new? in this contract?
Okay, so I mentioned LEAP, and again, the Clergy Alliance and.
Incorporated they're not new, but they were.
They're not brand new, correct. May Dugan is a new vendor that's under this program as well. And hold on a second, I'm just double checking. The City of Bedford is new under this agreement as well. And some vendors added services too. I'm trying to think, I'm just looking at my list to make sure I'm not missing anybody else.
I'd like to hear briefly while you're doing that from the City of Bedford, May Dugan, and LEAP.
Sure, and we don't have representatives from those vendors here today. The
Oh, no,
vendor
no.
that we have a representative for is Murtis Taylor.
Okay.
And those are the new vendors under the program. If I miss anybody, Daphne, just refresh my
Okay, so Murtis Taylor has something new or some new services added?
They're just one of our vendors that has provided services for a long time, and we wanted to have them there, in case you guys would like to hear a little bit about how this funding helps support their service delivery under this program.
Okay, we can hear from them. Yes, Daphne?
Hi.
State your name for the record.
Daphne James, Division of Senior and Adult Services. The new providers were Ashbury, Bedford, Leap, Fairhill, we have 4 brand new ones, and Fairhill,
Okay,
and Greater Cleveland Neighborhood Center.
Bear Hill, Greater Cleveland?
Yes.
Okay. And you said Ashbury?
Correct.
Okay, that's the computer center?
Mm-hmm.
Okay. So we have Ashbury, Fairhill, City of Bedford, May Dugan, and LEAP are new. Okay. Is any of them here? No? Okay. They don't have to be, just wanted to give them the spotlight,
Well, we didn't want to crowd the room either, okay?
Oh, wow.
You have more space. So we can hear from, any questions so far from my colleagues for Paul or Daphne? Councilman Miller and then Sweeney?
My question, Madam Chair, to the directors is how the part about outreach services was bid out. Was it bid out in a way that you could receive multiple proposals? And did you receive any additional proposals besides that one from the Clergy Alliance?
Absolutely. Thank you, Councilman Miller. So all of the services that I described were included in the same RFP. We did receive multiple proposals for that. At this time, we were looking at funding not only the Clergy Alliance, there's a couple of other vendors as well. So it was included as part of the menu of services, not something that was exclusively targeted at the Clergy Alliance. Similar to how transportation, we asked and made sure that the RFP went out to anybody interested in providing transportation and expressed to STC, who had a standalone contract, that this RFP was their opportunity to submit a proposal and that we wouldn't be doing a separate standalone contract again for 22.
So what other agencies are providing outreach services?
So we have the Hispanic Senior Service Center and Cleveland Clergy Alliance, and we didn't do these, and East End.
East End, okay.
Wasn't it? Let me pull out the list really quickly just to double check
Excuse me, Paul, can you
on
speak
that.
into the microphone, please?
Sorry about that. I'm going to pull out the list and make sure we have the right vendors listed. And I wanted to clarify a couple of the vendors that Daphne mentioned, like Ashbury, for instance. That was part of the digital literacy proposals where, again, the proposals were good. We would have recommended them for award if we had the additional funding. They're not one of the agencies that you see listed as a member of this contract right now. So I want to make sure only the vendors that are listed in the, in the list of vendors on the resolution are the ones that we were able to move forward with an award on. The digital literacy ones, it wasn't because we don't want to provide funding for the service or because of, poor proposal quality or anything. It was just the funds availability at this time.
Okay, I don't see Fair Hill listed. Is Fair Hill one of them?
Fair Hill was also included with the
In the
digital.
digital literacy?
Yes.
Okay.
Yep.
And, I don't know, Councilman Miller, are you?
I have no further questions.
All
Thank
right.
you.
I just wanted to ask a little bit about the digital literacy. So the digital literacy component, I know there was discussions probably in our office around budget times and things of that. We know we're, so just a question, and David might have to answer this question. In regards to the ARPA funds that are put into a bucket category, and I know that we are putting some funding in that bucket area for broadband and things of that. Would these agencies, since we didn't have funding within our umbrella, would they be eligible to apply for that money through the ARPA funds in that bucket? I hate to call it bucket, but.
No, I understand. I think it's a great framing of the opportunity. David Merriman, Director of Health and Human Services, and I'll ask Tracy Mason to come up. So I just want to acknowledge that I think as Tracy's managed this service and this network of providers, one of the things she's recognized is the pressure that COVID has created, as well as the opportunities for us to take another look at our service community and the services provided to residents. She's made a recommendation that we draw ARPA funds to be able to fund those programs because of the innovation value that they offer. Now, it's something that we're looking at still, and I know that the county executive's office is working very closely with county council to allocate ARPA funds, but it is a suggestion. It was something that Tracy pointed out and she recognized because she saw a tremendous value in the services. The flip side is the need has changed, and we needed to use the funds we had for the proposals that are before you today. So I don't know, Tracy, if you'd want to come up and add anything to that.
Thanks, David. Tracy Mason with Senior and Adult Services. Yes, I am thrilled that we were able to actually work with 4 agencies to provide digital literacy, that we are working through the logistics with Catherine Tatajczyk about accessing American Rescue dollars to fund the 4 organizations that was mentioned earlier. And once approved, we will be coming back to council to amend our contract to add them towards the master agreement.
So you want to add them eventually in here?
Yes.
Okay. But I know the ARPA dollars are going to be kept separate, so would that be a process? Would they try to go through that funding first, and that gives you guys time to see how we would incorporate it later in the master contract? I don't know. I'm just trying to get a picture in my mind.
Absolutely. I imagine that we're going to have to tease out those ARPA dollars when it comes to reimbursement. Not sure exactly what it's going to look like just yet, but we're meeting and discussing the logistics. Okay. Yep.
Councilwoman Conwell, Director Merriman and I just received clarification yesterday afternoon. We're waiting for final approval on it, but our understanding is any competitive procurement that postdates ARPA passing, which this RFP postdates the passage of ARPA, that we should be able to consider it competitively procured under this RFP, as long as those dollars are authorized. It would still sit in a separate account, but we could add those vendors to this master agreement and pay them with ARPA dollars. We wouldn't have to keep it, in a whole separate contract, as long as we kept it in a separate account. Again, don't take that 100%. The federal government still has to clarify some of it, but that's our hope, that we wouldn't like have to do a new procurement just for that service, especially because we received quality proposals.
Okay. Thank you. Any other questions for the director, Paul, or any? Okay. I'll bring Murtis Taylor up now. Okay.
Perfect.
Unless you guys have something else for me.
While we're doing that, if I could just clarify, so the two vendors that are doing community outreach are the Hispanic Senior Center through Catholic Charities. We made that award determination based not only on the strength of the proposal, but the fact that they're providing services to kind of an underserved demographic under the program, the Hispanic community. So it's them and the Cleveland Clergy Alliance at this time. Again, kind of like what we said about digital literacy, that's a new service for this contract. So in order to stay within the confines of our budget, we had to kind of pick and choose what programs we were able to fund for that service. And those seemed like a couple of good agencies to pilot those services with, if you will.
So East End wasn't included in this?
Correct. They're not one of the ones for community outreach. I just wanted to clarify that. Thank you.
And I guess briefly, so we know that we have funded Cleveland Clergy Alliance, but not up under this master contract. Was it the same for the Hispanic Center?
The Hispanic Senior Center, Councilwoman Conwell, did not have funding for community outreach before because it's a new service, but they did have funding for adult development, transportation, and meals previously. And we're continuing to fund them for those other services. We just added, it's a $25,000 funding amount for that. And again, really it's to see what the uptake on that is and help roll out the program beyond what we're doing now, and have been doing with the Clergy Alliance.
I have a quick one, if you can.
Yes, Councilman Sweeney?
Thank you, and once again, nice seeing you, Tracy. It's a 2-year contract, right?
Correct, thank you.
And the dollar amounts are annual, or is it the total of the 2 years?
So the total dollar amount is what's listed in the resolution. The annual dollar amount would be that amount divided in half.
Okay, so the number we see for Applewood Center is $2,765,000 for each year, or is that the total for the 2-year?
So that's the total for the 2-year period. The amounts that are listed in the caption are for the 2-year period.
Thank you. And just, I look forward as time goes on, because me saying I'm the new guy anymore, because since mayor this year, that stick's going to go away fast. But I still have a lot of learning to do, and I wouldn't mind taking the time to understand how the pilot programs are offered and understood and ranked and all that stuff, and see if I can add some value to the process as time goes on. So that's something we can follow up on by looking at this and your testimony today. Thank you.
I just wanted to share, I participated in that, and I think Councilman Miller may or may not have, so you just missed it where we're doing the funding now, but it's an interesting process how they
This
participate
is all a growth opportunity for me.
and I participate. I don't know if I did any scoring, I don't remember, but Paul could share a little bit about that.
Absolutely.
I'm learning that the county government is a lot more vast than I anticipated before I had the privilege of starting as a council person. I'm excited about it. Thank you.
Before Lavelle Custer come up and join us, come on, Lavelle. Come on. I just want to say that Paul gave all of my talking points earlier, but the only thing I would like to add is that we've done a tremendous amount of work in expanding meals. And so before you, we, a couple years ago, received support to add holiday and weekend home delivered meals. So we were able to fold that into this contract period as well. And Murtis Taylor, while they receive a number of services for us, they were one of our partners who really expanded their bandwidth throughout the county to provide more home delivered meals.
Welcome. State your name for the record.
Committee Chair Conwell and council members and members of the audience, my name is Lavelle Custard, President and CEO of Murtis Taylor Human Services System. Thank you for the opportunity to speak. Murtis Taylor has provided senior and adult services since its founding in 1948, and for the past 4 decades, the county's Department of Senior and Adult Services has been our primary funder and supporter of senior and adult services funding. Currently, we provide services to approximately 300 county senior residents, including meals, adult development, transportation, socialization, and information and referral services. During 2020 and 21, along with most industries, the senior services sector faced unprecedented needs and challenges. Under the leadership of Administrator Tracy Mason, DSAS has been our strongest partner, ensuring that the county senior services were uninterrupted and tailored to address the challenges of the pandemic. Administrator Mason increased communications and coordination to an unprecedented level as DSAS led the county's network of senior and adult centers. DSAS established a weekly video communications loop that allowed senior centers such as Murders Taylor throughout the county system to have access to the latest information from the CDC and other reliable sources, to allow centers to make requests for information and support in real time, and just as important, to receive information and responses in real time. DSAS has provided funding to access to vaccinations, testing, staff professional development, infection control, resources such as masks, gowns, gloves, and sanitizer, addressing the fear that many of our seniors experienced and currently experience. Moreover, DSAS has helped the county system of senior centers to clarify the regulatory changes occurring due to the pandemic. Murders Taylor Senior Center was able to pivot from in-person to virtual services and back to hybrid of in-person and virtual services. DSAS provided guidance, support, and resources to shift hundreds of meals to seniors from congregate format to home delivered format. DSAS guided us with moving in-person adult development services such as exercise, crafts, and recreation to telephonic and video formats. And just as important, DSAS provided the guidance and support for us to pivot back to in-person services safely and in accordance with CDC guidelines. Committee Chair Conwell, council members, Murders Taylor provides services to nearly 10,000 county residents each year, and the seniors that we serve are some of the most vulnerable that we serve. The need for senior services and support continues to grow in 2022, and I thank you on their behalf for your commitment for these additional resources. Any questions?
I have a couple of questions, President Custer. In terms of the contract for the $815,000, I know you have several centers. Does that cover all the centers or just a few in particular?
The DSAS contract supports services in the Mount Pleasant community and in the East Cleveland community, where we focus the particular senior and adult services.
And then my other concern, and this is for all the agencies, and I don't remember what Paul said, if we increase this contract or not, food costs. So we live in the real world, all of us do. When I go to the grocery store, everything seems like everything is $5 at least. So I'm just asking, since you have the floor, is that been a concern or has that been a conversation? I know this just recently happened, but the food costs are expensive. So I'm concerned, how is an agency such as yours weathering that storm, since you're doing pretty much all of it? You're doing the in-house meals as well as the delivered meals.
Committee Chair Conwell, we are always in need of additional resources for food and other supports for our services. In 2020 and 2021, through a variety of sources that came through the federal government, the county, Western Reserve, the city of Cleveland, we've been able to weather those increases and the need for increasing the amount of food. The prices really didn't start to increase in terms of food until around December, November of this year. We are seeing some of that increase. However, our sources of food, such as the food bank and donations, are weathering the storm, and we're confident that the support we will receive to actually provide the cost of the food will continue in 2022. The awards are coming in sufficiently at this time.
The increase in cost, and also just talking to clerk upstairs, our assistant, and access to food. Is that a concern for anyone out here? I mean, when I go to the grocery store, I'm not seeing bread or whatever, so I just want to make sure.
Yeah,
when
we have seen that the amount of hunger and the need for access to healthy food has increased. And through support from the county with respect to farmers markets and some of the other projects, we are able to provide fresh and healthy food through our other supports and through direct funding from the county.
Any questions for the director? Thank you. Thank you for your time. Thank you for coming up. Well, anytime we have a CEO and a president come, we got to bring them up. Any other CEOs or presidents out there? Because we know you're busy. So I'm honored. Thank you. Thank you for coming out. All right. Seeing and hearing no questions, Paul. I know there's always need, and I'm always careful to ask that question because everybody would raise their hand, but I'm just speaking from my perspective in actually seeing these rising costs for food, and I know they're just not being put, at the grocery store level they have to be experiencing that too. Was that considered when you guys were in negotiations? And that might be a David question. And I know this recently happened too, it hasn't been long.
Yeah, I mean, again, David Merriman, Department of Health and Human Services. I do want to, I'll let Paul answer the question about the rising costs and our concerns, but it's probably worthwhile also foreshadowing. There's discussion about taking another look at food security as a county and utilizing ARPA funds. So just so we're here today, and I would foreshadow there will be some discussion and some presentation on ideas on how we can use ARPA to really tackle both some of the immediate needs that are the result of COVID and help our communities recover, but potentially also look at the long-term implications of, I think, what are clear pressures on individuals, families, and communities. What sort of structural changes are needed to actually respond to sustained food insecurity. So it's more to come, but I think we share your vision and your concern about how the market is making it very difficult for families to afford quality food. But I'll ask Paul if he also would answer anything about did the RFP consider the cost of food?
Thank you very much, David. I should have mentioned this earlier in the presentation because we considered rising costs for all of the different services. When the proposals came in, I think I mentioned that we had almost $8.5 million worth of proposals, and we aren't able to award that much in funding. So we did have to look at, the dollar amounts that each vendor was allocated. Historically, this funding has been almost like a grant to the service providers, so it is paid out on a unit basis. We have a rate per meal, a rate per trip, a rate per hour for activities. For the most part, our rates do not cover 100% of the cost. We, work with a lot of nonprofits and municipalities. They're able to use other funding sources to help kind of meet the entire cost of a meal. If a meal costs $9 to provide, when you factor in staff time, the cost of the building, the cost to deliver a meal for home delivered meals, we aren't able to cover that entire $9, but we were able to take a look at what the proposals were, what we were currently paying, and we tried to index our increases as much as we could to what inflation had been in between the time we made the last award and this current award. Some vendors came in with a proposal that was under that cost. So if the proposal was lower than that, we gave them an award at the dollar amount they were proposing. Some vendors came in higher than that, and we made phone calls to them and said, hey, you proposed $9, we can pay you $7.50. Will you accept that funding? We didn't have a single agency for services under this contract that pushed back and said, no, we don't want the funding. Everyone was willing to accept it. So that might not take into account your question of, the last couple of months price increases, but it really did try and take into account that we know that the cost of doing business has risen since the last, dollar amount was negotiated. And we tried to make our rates reflective of that, I would say.
Okay, And that's my concern, because with beds and all the different things, sometimes we get in the gaps. We let it go and go, especially with the food bank. That's one of my major pet peeves, is they went for many years weathering the storms with all the increases. And so it took a pandemic to get them extra money. So I just want to make sure that we're all on the same page.
Thank you.
No other questions. I'm going to move this, ask that someone move R 2022-0025 to the full council under second reading suspension.
So moved.
Second.
Moved by Sweeney, seconded by Miller. All in favor, please say aye. Aye. Thank you very much. Madam Clerk, if you could read the last item into the record.
Resolution 2022-0026, making awards on various requisitions to various providers in the total amount not to exceed $123 million for out-of-home placement and foster care services for the period January 1st, 2022 to December 31st, 2023.
Good afternoon. Paul Porter, Health and Human Services, on behalf of the Division of Children and Family Services. This is a 2-year award recommendation on 2 RFPs for out-of-home care services. Those are the services that the Division of Children and Family Services administers for residential placement for youth that are in county custody. That includes residential settings like foster care, group home placements, residential facility placements, and even partial hospitalization placement for youth in custody. The RFP award is for $123 million over a 2-year period, which represents the same annual dollar amount as our 2021 funding of $61,500,000. I mentioned that we had 2 RFPs. We received 54 responses to the original RFP, and DCFS indicated that that wasn't enough to meet the current demand. So we did have to go back out and did a similar alternative procurement and reissued a secondary RFP. And we were able to bring those award recommendations as well as the initial recommendations before you together. So we ended up with a total of 59 respondents, of which we are awarding 57 of those. The remaining 2 vendors opted not to continue with the award process. The one, they weren't willing to lower their rates enough to meet what we were able to pay. And the other had difficulty obtaining insurance in a satisfactory amount for the county and opted to bow out of the process rather than increasing their insurance coverage. I want to stress that a lot of work went into making sure we can have as many beds as possible available for the Division of Children and Family Services. To that end, the county executive authorized, as part of our negotiations, that we could do price increases over what our prior rates were in an effort to keep those beds available. These are vendors that were used to no price increases in some cases and very minimal price increases in others. And the situation that DCFS would run into at times was that other counties, both within the state of Ohio and jurisdictions outside the state of Ohio, would be willing to pay a higher rate for the same bed than what we were able to pay under the contract. So a bed in Cuyahoga County might go to a youth from Franklin County or Summit County if they were paying a higher rate for that bed. Obviously, that's not acceptable to us, so we worked as much as we could with vendors to get rates that were acceptable to the vendors while at the same time workable within our budget. Some vendors got the rate that they were asking for if it was within like a 5% rate increase, let's say. Other vendors, we had to work with them and say, your rate is 25% higher than what we're paying now. Are you willing to negotiate? Again, we're entering into a contract with 57 vendors, and that represents all the vendors that submitted a proposal that were willing to work with us. There was only one vendor, and it was an out-of-state vendor that we had never worked with before. I'm not going to disclose their exact rate, but it was much higher than what we pay many other vendors for the exact same type of placement. And when we asked if they would be willing to lower their rate to come more in line with what we're paying for that service locally and for some other out-of-state placements, they did decide to bow out. Again, I'll note that the dollar amount in terms of annual funding is the same, but some of these vendors have increases from the rates that we were paying before. The thing that's good about this submission is that we're submitting a 2-year agreement. So we're hoping that that means we've got our rates locked in with these vendors for 2 years, and that we're going to be able to maximize the number of beds we're able to use under this contract. The RFP did allow for a third option year for calendar year 2024, should we choose to exercise that. I'm joined by several representatives from the Division of Children and Family Services, including Director Cindy Weiskettel, Deputy Director Jackie Fletcher, and David Gray, who oversees the out-of-home care program. Additionally, there are 2 vendor representatives here. Margot Williams is here from Applewood, and she was able to represent FCSS and out-of-home care both. Additionally, Chip Bonsudo from Ohio Mentor, one of the other vendors, is here. And I'm sure they'd be able to tell you a little bit about the provider perspective on these services. It's hard. I mean, there's the beds that we are contracting for under this. Every other jurisdiction in the state and jurisdictions outside the state are competing for the same bed. The contract that we're putting forward, we think, puts us in as competitive of a position as possible to ensure adequate placements are available for kids in county custody.
All right, thank you. I want to keep the questions short. We do have a presentation. Really don't want to, okay. Sweeney.
Thank you, Madam Chairwoman. Just by hearing your tone and the seriousness and amount of effort on this particular piece of legislation, it's should be commended for it. And excited that you were able to put it together and be competitive for the folks that we are here to represent. The third year, is that on our control, or is who controls the option for the third year?
Correct, Councilman Sweeney. The way it's written into the contract is that we could exercise an option for an additional year of funding based on funds availability, agency priorities, and provider performance. So we have to have the funds, we have to determine that this is a priority, and we would opt to extend with any providers that are meeting our performance expectations. We would have the opportunity to move forward without vendors that aren't meeting our performance expectations. But again, the message is we need access to all the beds we can get.
Absolutely.
Under this contract.
And at the same dollar amount.
Correct. I will note that when we've done amendments in the past, vendors ask if we can do rate increases. So this locks us in for that 2-year period. I would not be surprised if for the 3rd-year period, we get requests from vendors saying the rate's the same as what we agreed to at the end of 2021. X amount of costs have gone up. We need a rate increase. That would be addressed in the amendment if that occurred.
And thank you, Madam Chairwoman. Once again, of all the pieces of legislation that I've heard, congratulations on this one. I think you should go home and rest after this.
Thank you. It was a team effort. The DCFS team was more responsible than me for that.
Thank you.
Thank you.
Councilman Miller?
Yes, it sounds like the total dollar amount is essentially the same and the rates have gone up, meaning that the total amount of services is less. Is that a correct assumption?
The rates have increased, yes, and the dollar amount is the same. So if, services were delivered in the same amount, then yes, I would anticipate we would exceed the dollar amount on an annual basis. David, I'll let you take that one.
David Merriman, Director of Health and Human Services, and I'd open it up for Director Weiskettel to speak on this matter. Councilman Miller, your leadership on the budget is always well recognized. I certainly understand you would acknowledge this point, and I would acknowledge that in this market, we must maintain a rate structure that makes us as competitive, if not more, than the other providers in our state. And I'll let Cindy, if needed, speak to that market, the number of homes and placements that are available in Ohio does not meet the number of children needing those homes. And I just want to step back and say, by the way, those are not cases and not those children. Those are literally our children. Those are children that are the children of Cuyahoga County. And I would just say that, yes, we're going to have to manage this. We're going to have to watch it. We understand our rates have increased. Our budget has not. We have some really exciting programs that are still being developed, such as the use of kinship care. I think we're still developing some other options that would help us maybe find ways to have children not go into some of the most expensive placements. But this becomes a day-to-day, week-by-week issue. And I want to share with Paul nothing short of accommodation of David Gray and Jackie Fletcher and their team. I think they worked literally 24/7 trying to find the right placement for the right child at the right time. And but yeah, your point is well taken and well made.
And Madam Chair, Director, I know it varies from agency to agency, but could you kind of give me an average of what the percentage increase in the rate is across the board?
So, I think that's at a level detail that I'll take a pass on. But what I would suggest is maybe it makes sense for Cindy to talk just at least a little bit about the variation of provider to provider to provide context for why the rates would change. Because I think not all placements are the same, and therefore not all rates are the same. I don't know, Cindy, if you'd agree with that.
Cindy Weisskettel for DCFS. There are two things I would share. In the last few years, we have seen a decrease in the number of children in custody. We have about 2,550 kids currently in custody. And that's, like I said, a drop of a few hundred kids, which is helping us save on boarding care. David is correct. When you look at kids in custody, there are 6 levels of care that they can need. And the level of care, the higher the level of care, the greater cost associated with it. It is also true we have almost a third of our children placed with kinship care. We're very proud of those numbers. It is what's best for children whenever possible. So that is helping us as far as boarding care. So if you're looking at a level 6 kid that is a residential bed, it could be $300 or more a day for that bed. If you're looking at a basic foster home bed, you might be looking at more like $30 or $40 a day. So again, it really depends on the level of care a child needs. And frankly, sometimes we do add-ons to the rates in an effort to get a kid placed.
So, Madam Chair, Director, I appreciate all of that information and it's helpful, but I would also like to know what the average rate increase is among the agencies, and if you can't answer the question immediately, it'd be fine for you to get back to me.
Thank you, Councilman Miller. I'm comfortable stating that the average rate increase ends up being about 5%. Some vendors, it's less than 5%, because again, some of the vendors propose their own rate, and it might have come in at less than a 5% increase. They might have proposed a 2 or 3% increase, and in that case, we awarded the contract at the rate they proposed. So I'm confident in saying that the 5% figure is about as accurate as you'll get. We can take a look and try and get a more exact number, but generally 5% is right about where we are.
I'm willing to accept that number. I just wanted to get a general sense. Thank you.
Thank you.
All right. I'd like to move R2022-0026 to the full council under second reading suspension. Can I have a motion, please?
I second.
Didn't catch your voice. Turner moved, seconded by Miller. All in favor, please say aye.
Aye.
Okay, thank you, Paul.
Thank you.
I just wanted to say thank you to each of the agency providers for joining us today in person. Your time is appreciated just as a CEO and a president. So safe travels in the weather, and we now have a presentation that we need to hear. You're welcome to stay and hear it. Hitchcock Center for Women. We can invite up Executive Director Jason Joyce. And it's going to be a hybrid meeting presentation, I believe.
Madam Chair,
Yes.
before you start the presentation, just one other thing. Could I have my name added to Resolution 2022-0025?
Did you get that?
Yes, I did.
All
And
right.
my name as well, Madam Chair.
Okay, and Turner.
Thank you,
You tell
Madam
the
Chair.
clerk, but I said, let me incorporate. I knew mortality, we all on that issue. So, okay.
Also, Madam Chair, I'd like the record to reflect that Councilwoman Stevens is in attendance.
Thank you. Jason, you can begin.
Thank you so much.
Welcome.
Jason Joyce, Executive Director for Hitchcock Center for Women. Thank you so much for having Hitchcock back. I know we presented in the summer. And with this, we'd like to give a little more detail about some of the plans that we've been working on. In attendance today is Mark Dodds from the Finch Group. He's in the audience. Also, Vicki Johnson from the Cleveland Clinic Foundation. And then on the line, we have Blake Bennett and Wes Finch from the Finch Group. I believe Blake is going to kick us off remotely, and then I'll go through a brief PowerPoint presentation from there. So Blake, I don't know if you can hear me?
Yes. Can
Great.
you guys hear me?
Yes, we can. Thank you.
Terrific.
Welcome.
Committee Chair Conwell and Vice Chair Sweeney and council members, thank you for giving us the opportunity to present. Because of our 25-year history operating in Cuyahoga County, most of you know who we are. For those who don't, the Finch Group, develops, manages, consults on all different types of real estate on the eastern half of the United States. We've been doing it for the better part of 40 years. During our time in Cuyahoga County, I think we have developed some of the more transformative and catalytic real estate in the city of Cleveland. Starting in 1998, we turned 800 units of absolutely deplorable housing into 629 units of award-winning affordable housing in Arbor Park Village. We then took a long boarded up Section 8 property in University Circle and turned it into the first high-end housing in that neighborhood. University Circle Incorporated credits Park Lane Villa for being the transformative investment that changed the residential dynamic in that neighborhood. The Finch Group was awarded the Joseph Piggott Award for Park Lane Villa. Finally, when Mayor Jackson launched his neighborhood transformation initiative, the goal was to leverage success stories like University Circle in surrounding neighborhoods. And the Finch Group was awarded the first transaction out of that initiative, and now standing on East 105th Street as a mixed-use building, Glenville Circle North. But I think I can speak for the Finch Group in saying that of all the development we've done in Cuyahoga County, which is about $300 million worth, there's none we're more excited about and more passionate to see through than Hitchcock Center for Women. We've worked on the east side, we've worked on the west side, we've worked with multiple county administrations, city administrations, and council members. We were asked a couple years ago by the Jackson administration to take a look at Hitchcock. And the goal was, how could we find a workable plan that hopefully would secure Hitchcock's future and allow them to do what ultimately amounts to life-saving work with their current building being obsolete. This was of great importance. Hitchcock Center for Women gives women who suffer from the disease of addiction a place where they can go and heal physically, mentally, spiritually, and emotionally. And many of these women have suffered from domestic violence. So in talking to Greg and Jason and understanding that if you could layer on a housing component to go with the treatment, the success stories and the success rates really increased dramatically. So this was really a perfect match. And in starting this process, we knew that the funding for this was going to be a heavy lift. Unfortunately, the resources are not readily available for facilities and projects like this. So we were thrilled when the city of Cleveland stepped up to provide $3.5 million of funding for this development. The Cleveland Clinic Foundation is providing a grant of $2.5 million. The Adams Board supports this dynamic plan. And now we get to our ask of county. We ask that county matches the city's funding of $3.5 million, and that the county be that final piece of the puzzle that closes this funding gap and allows this incredible development to move forward. First, I want to turn it over to Vicki Johnson, who can articulate why the Cleveland Clinic is supporting this. And then after that, I think we should turn it over to the stars of the show, Jason and Greg, who can really dive into what makes Hitchcock a remarkable place and why this is something we should all get behind. So Vicki, why don't you talk to us about the Cleveland Clinic support here?
Great. Vicki Johnson, Senior Director of Government and Community Relations for Cleveland Clinic. It is so nice to see so many friendly faces. So thank you for that. So we are the private investor in this deal, and why did we want to do this? You just heard the overview of the project. So we were moved when we learned of the initiative for a few reasons. The women and children that they serve, that the women can keep their children with them as they receive treatment, and that housing would be added to that. So that all leads to a healthy community. So we're committed to caring for our community. These are our neighbors. The project is located in Greater University Circle. So we felt obligated and extremely happy for the opportunity to participate because of the history and the track record of the Hitchcock House, as well as the support that it had from the councilmen in the area. So this is what we consider a social determinant of health and the health that happens outside of the hospital. So we're very concerned and happy to participate and make this gift, historic gift for us, to support this project and to support our neighbors so that we can create the healthiest community for everyone. And that's our story. And we're sticking with it. And we hope that it gets the support that it needs so that it can move forward.
I do have one question for you, Ms. Johnson. In terms of commitment, okay, you've committed. I just need to know, is that in writing? How is that handled?
It went through an internal process where we've received commitment from our chief of staff and from our executive team and CEO. We will put it in writing once all of the commitment is conditional upon all of the financing coming together. We can't forward the dollars unless we know that it's fully funded and that it will actually happen.
Then my question to you, Jason, would be, because I don't want to forget it, the construction schedule that you're facing. So if that's part of the discussion or presentation, I just want that area covered.
I know that's a part of the presentation that towards the end, that when we get to the sources and uses, we can go over with Blake and Wes, and they can kind of walk you through that process.
Councilman Sweeney.
Thank you, Madam Chairwoman. Madam Vice President, how are you? She's my longtime friend from way back. Is there a drop-dead date for you guys to have internally to keep this money available for this project to either be a go or no-go with your internal clock? I'm just trying to get some pressure points on us here.
Absolutely. We would like to forward these dollars in 2022.
2022 signed, and if not, there is a possibility that the dollars will not be there anymore.
The commitment is firm,
No,
but the dollars, yes.
I'm trying to put it in a positive way here.
No, absolutely. The dollars that we've committed, we really want them to leave Cleveland Clinic and be delivered for the project in 2022, this year.
Good. And I'm going to go in my own mindset that if the dollars aren't spent in 2022, they might not be available, from my own perspective.
Another process would be undertaken to see if that dollar amount is still available.
It'd have to be looked at again in
Correct.
For the 2022, 2023 calendar, 2023 calendar year.
That is correct.
Thank you.
You're
It was
welcome.
fun talking to you.
Councilwoman Stevens.
Thank you. Hello. I see that there is a 9% low-income housing tax credit application in your future. Is that February 10th that you're doing the application this year, or is this for a future year?
I believe it's for the future year, correct, Wes?
That is correct.
State your name for the record, Wes, please.
My name is Wesley Finch. I'm the chairman of the Finch Group and one of the team of sponsors behind this overall plan.
So we're talking about how many housing units that will be contingent upon a 9% tax credit?
53.
Okay. So that typically you have to apply and then you get funded, and it's the end of the year before you can, even if you're like, you're good, because I've seen your work, you're good, but it's the end of the year before you can start after you get funded. So you're talking about a 2023 round of OFA funding?
We have to be talking about a 2023 round of OFA funding for the housing component of this project, yes. There are two components to this project, which I'm sure Jason will go into in a minute. The first is what I refer to as the treatment component. And because of, as Blake said, the statistics are overwhelming when there is safe housing, then we would go into a housing component that would be low-income housing tax credits, yes.
Thank you, Madam Chair.
Thank you. Any other questions? Okay, you may proceed with the presentation. Thank you, Vicki.
Thank you so much. Okay. Everyone has the handouts. We'll just go through each slide. I'll just let you know which slide that we're on. First and foremost, I just wanted to kind of go over what makes Hitchcock Center for Women unique, right? So what makes us most unique was, one, that we take mothers and children, with the children being up to the age of 12, into our recovery housing and residential treatment units together. Also, we have a strong link with recovery housing. So people go directly from residential, they can go right into recovery housing. And our specific recovery housing allows for medication-assisted treatment of all kinds. Now, I know within Cuyahoga County and the surrounding counties, that is difficult to find. Very many recovery housing providers do not allow certain medications onto their houses, but we provide and we allow, I should say, all of those. Also, there's a school right next door so that we are able to have the children in school, again, up until the age of 12. No other provider does that. Most providers, if they do it, they only go up until the age of 5. And what this really helps out with is what I believe that you heard earlier with foster care placements. So when the children are allowed to stay with their mothers, they don't have to be placed into foster care. So just wanted to give you just a brief refresh of that. I know we went over that several months ago, but those are sort of the highlights of what makes Hitchcock unique when compared to all other providers, not only in Cuyahoga County, but I would say within the state. So there's two main programs. The residential treatment program, so that's usually a 30 to 45-day stay. We provide all the great treatment modalities with that. And then also our recovery housing. So that's a safe sort of dorm-like environment now where they can get all the outpatient services and alcohol and drug support that they need. In addition to that, we provide them with links in the community because we know the end goal of all treatment is to end treatment, so that we're looking at sober supports, whether that's AA, whether that's church, permanent housing, medical services, psychiatry support, all the linkages and support that they need so that they can eventually move away from us and go to those natural supports in the community. On the next slide, titled Linking Treatment and Recovery Housing. Oh, there it is. It's up on the screen. Great. This slide here talks about the statistics. I'll go into those in a sec, but I think that the big takeaway here is that, one, substance use treatment, especially for women on the severe end of that scale of use, is incredibly hard. And that secondly, that recovery housing makes a significant difference when you link those two together. So you can see that, and I got all this data from the Ohio Recovery Housing from the state in their research. So 15.4 times more likely to be abstinent at 12 months after treatment if it's linked to recovery housing. If you compare to people that successfully completed treatment, 35% are abstinent if recovery housing was linked, 69% if they had sober and recovery housing. And then when you look at employment, so those additional supports, 48% are employed at the 2-year point if they successfully complete treatment, 76 if you have sober housing. So it really takes good treatment and it kicks it up a notch even from there. The next slide is discussing the existing building. So as several have mentioned, the existing building is functionally obsolete. You know, we've been in it for around 30 years. There's been limited capital resources for that. You know, as you've known and as you've heard, you know, margins are small. The rates historically don't get updated frequently. It's enough for agencies to continue to move forward and support, even be innovative in some ways, but these larger infrastructure needs are difficult to save and build for. And then the building itself is a very complex building architecturally. It's prohibitive to be renovated. And really, if we're going to spend that amount of money, that we would want to build something that's going to meet all of our current needs and or future needs. Just some pictures on the next slide. I think one of the things that we really learned with COVID is that separate rooms are incredibly helpful. So we were able to mitigate a ton of COVID spread because every lady that enters both residential and recovery housing has their own room. Some of the rooms are bigger if they have children, of course, but no one has to share a room with an outsider or a stranger. We want to continue that moving forward. We think planning for another pandemic is something that is important. And that's something that we're carrying over. And then just some other general pictures. You know, as you can see, we're making use of the space, but it is rather dated. I won't go over the next slide too much because I know we spoke about it, but just a brief refresher on this slide is that the Finch Group is our developer. PMC, so Project Management Consultants, they are our owner's rep. The new building, so it's going to increase treatment beds by 50%. It'll also increase recovery housing beds by 33%. The City of Cleveland with the 3.5 that was mentioned earlier. Vicki and her discussion from the Cleveland Clinic. And then the local Adams Board, through a state infrastructure spending, has pledged that they can go up to $750,000 for this project. We were one of 4 agencies selected for that through our local board. It's not county dollars, they are state dollars, but they are overseen by our local Adams Board. A picture of what the new residential treatment will look like, along with a summary. Some highlights here. The private bathrooms will be a significant upgrade. Right now, we are in almost a 100-year-old building where there are, again, that dorm-like shared bathroom experience. Having the own bathroom will provide a much better experience for the ladies. We would say a much more dignified experience for the ladies, much easier to coordinate experience for our ladies. So that is something that we're truly excited about. In addition to some of these newer things that, you know, designated children's play area that was designed to be a play area, breastfeeding areas, changing tables, and a couple other items that you can see there on that slide. For the recovery housing piece, so again, looking at the 53 furnished units, that's a 33% increase from where we are at currently. What will be nice about this is that there's 2 flexible community rooms. We do not have that now. That could be used for, hopefully, especially once COVID goes away, or at least more workable, that we can have functions at that site, bringing community in. We have done that historically. We've had yoga. We've had spiritual experiences. We've had AA and other supports come in. So having those community rooms is nice to provide that flexibility for the women at Hitchcock. Arts and crafts room, fitness center. We know that you know, with addiction, giving back, the mind, the body, they're all connected in a meaningful way. So having those supports available to the ladies that is in a safe environment is key. So we wanted to add that as well. The next slide shows you sort of the aerial view of the new building and the differentiation between what the recovery housing side will look like and what the residential treatment side will look like. We will have them separated. There will be separate entrances for each, and the outpatient services will be in the residential treatment first floor wing. So we'll have coordination with any outside, and we'll be able to keep the recovery housing unit separate and safe from all visitors. The next slide is an example of the first floor. The slide after this looks at the second through the fourth floor, gives you an idea of the sort of the micro breakdown of how the respective recovery housing and residential ACM 3.5 units look. Again, highlighting the separate showers, baths, more privacy, more support. As far as the sources and uses, I know that the Finch group can kind of walk you through this slide if there's any details or questions. But here is on the first slide, here is the sources and uses of what we have currently, and then hopefully the tentative support of the county. And then on the next slide, it goes through all the use of funds in more detail, totaling out to zero. Difference between those two slides there. I will pause for any questions or anything I can help clarify more.
Any questions, Councilman Miller?
Are you planning to tear down the existing building and rebuild on the same site, or are you building on a new site?
That's a great question. We are not planning on tearing down the old building. We do have enough space on our campus to add this new structure in currently undeveloped land.
And what are you planning to do with the old facility?
Well, I know Wes has some ideas. I think it's gone sort of two ways, so that it could be an expansion of another entity using that as a corporate headquarters. I know there's also been some talk of recovery housing, especially as we get this other one kind of up and running, to refurb that one at a later date. I know there was some talk about a for-profit, but Wes, you want to go into a little more detail as to what some of your development experience would point to that new building, or the old building, I should say?
And sure, and Mark Dodds, I believe, is in the audience. Yeah, he was a founder of City Architecture, and he's been working with us now for the last, I think, 11 or 12 years. So he also has some ideas. But generally speaking, that building is historically significant, would qualify for historic tax credits. It lays out well for an office usage, not so well for a housing usage because of the width of the wings, if you will, and the center space, which is a chapel, which, while it's gorgeous, does not really provide the width you need for housing units, double-loaded corridor housing units. We, as working with the city and PMC, have promised to use our experience and our contacts, if you will, to try to land a major back office population in that building. There's more than enough space for parking. If we can get an office in there, that would be historic tax credits involved. We would probably be back, but in front of everyone, asking for some additional assistance. But at this moment in time, there are no promises, just a promise to work hard to try to make it happen. Hopefully, our track record in Cuyahoga County and in Cleveland would allow you to really think that we can do it. I think we can. It's in a unique neighborhood. It has all sorts of benefits for major banks to put back office there. With Opportunity Corridor, it also helps transportation. There's a lot going for it. Mark, do you want to add anything to that?
Yeah, my name is Mark Dodds. I'm an architect with the Finch Group. I think two examples I can give you here in Cleveland of how a historic building was transformed, taking advantage of the historic tax credits, which you need to be a for-profit entity to do, is like the Nottingham Spurk Innovation Center, where an old church was turned into an industrial design and prototype manufacturing studio, and the Children's Museum that is on Euclid Avenue in the Midtown area. Again, another historic building that was converted into a commercial use. It has to be a commercial use that generates income revenue in order for it to be eligible for the tax credits. So that's where we want to look first, see if we can find somebody, and PMC has agreed to work with us on that effort.
Thank you, Madam Chair.
I got a couple. Thank you, Madam Chairwoman. Hi, Mark, how are you? This just seems like a project that needs to be done. And all the pieces are coming together, and it seems like the county's the last piece in regards to the funding stream. And if that gets finalized with the $3.5 million request, does that complete the project and it's a move forward?
It would. Pending the low-income housing tax credit application, of course. But yes, it would move the project completely forward.
Okay, and then how long is this, through the chair, how long has this been in the making?
Roughly 2 years.
2 years? Yeah, I'm just getting caught up to speed here. And the principles that are involved just gives me a comfort level. With the Cleveland Clinic stepping out of their norm to add a little extra value and having Vicki as the point person. The Finch Group I've had the privilege of working with for quite a long time as Cleveland City Council. And the one little, what Wes says he does, he will do. And he takes neighborhood and he collaborates. We had an issue in Ward 16, a little place, and it was a apartment building that was a detriment to the neighborhood. Said we can come in, we can get tax credit, and we changed it from Hawks Landing to Rockport now. It's part of the neighborhood. He is a community portion or a partner with our local CDC. So the developer is rock solid, and they do wonderful work. I'm just going to ask, with the administration, because we're council, is there a conversations happening with them? And if so, or to us what you believe they might be thinking about, or you can be silent on that as well?
I have not personally interacted in that way, no. But Wes, I know that there was maybe some informal discussions. I don't know if there's anything else you wanted to talk about with that.
I had a conversation with the county executive, I want to say 4 to 6 months ago. It was essentially a one-on-one conversation. He liked the idea. Again, this is a conversation. There's no commitment. Yeah. He agreed with you, Councilman Sweeney, that this really had to be done, but where's the money going to come from? He challenged us to get the city's commitment first, which we have now completed. So I would hope, and I've not spoken with him after we received the city commitment in the beginning of December. We plan on speaking with him or through Chairman Conwell to speak to him. And I'm hopeful that since this is the last piece of the financing that will make the treatment center a reality, that the county, through the county administrator, county executive, will come through with the funding. We're aware that there are sources of funds available. The question is this something the county would like to do?
And thank you. I just wanted to put that out there. And as I said, I've had the privilege of knowing the chairman for a long time. And when he spoke about this from us, can you tell me, Chairman, this project moved you? I know you don't want to talk about it because he makes his money. The projects are always good, and every I and every T is dotted. But in this particular one, he said, Councilman, this needs to be done. This could have such a tremendous impact on these women's lives. So I was moved by it. If you want to share it, it's up to you. And
I'll share it. I was introduced. Mayor Jackson's administration asked me to look at it. I went out there probably more than 2 years ago. I'm thinking. I came home, and my wife has been trying to get me to slow down. And I said, honey, I've got a new project in Cleveland. She said, you're supposed to slow down. I told her what it was. She said, you can do that one. We are doing anything to do with the treatment center, the treatment facility, for where this funding is going. The Finch Group is working 100% pro bono on that. We, in the housing part, which is the low-income housing tax credits, as everyone I'm sure knows, Ohio Housing will assign a developer fee, and then we would expect to receive that developer fee. But as far as the treatment goes, we're not charging a penny for that because the funding is tight. The construction budget is conservative at this time, but tight. And in my estimation, this just has to happen. This is too important. And especially with the diversion center, I think Jason can go into that possibility of moving some of the women over to Hitchcock Center. That is above my pay grade when it comes to treatment, but I think that's also a component of the need of this type of development.
Correct, Wes. We can rapidly, the diversion center is set up so that it's a short term. So, within those 7 days, they really want to place somebody, especially if they need recovery housing or a longer term residential setting, to have those beds ready and available. So you're correct, Wes. We would stand ready to support that, and we have made the county aware of that, and that's part of the focus.
And thank you, Madam Chair. I'll wind down my comments at this particular moment by thanking the chairman, but also put in perspective that every partner's here putting something in that is trying to make this project work. And it's a lot of sacrifice on some ends, a lot of decisions on dollars can go anywhere. But if we all make the commitment that this is the thing that would benefit this group of ladies that have been not focused on, is my comments at this particular time. And Madam Chairwoman, I yield the floor at this moment.
All right, Madam Chairman.
Stevens.
Thank you. So if we were to facilitate a commitment of $3.5 million to you today, when could you break ground?
I believe 2023, is that correct, Wes? Is that the current late 2023?
It is possible
so you aren't
that we could start on the treatment center before year-end 2022, but more realistically, I believe would be sometime in 2023. As Councilwoman stated before, this would be a 2023 OFA ask. They have already indicated a willingness to participate, but they need to see the funding sources.
So here's my question. You could separate these so that you have the treatment facility and begin construction on it and do a separate application with some of the funding deferred for the housing. Because we are, of course, concerned about access to treatment units. And of course, for those of you who know me, I love the fact that you're pulling together funding from OFA and that you want to bring more tax credits to Cuyahoga County. So we will be very supportive of that, but I'd love to see these units break ground in 2022 so that they could be occupied near the end of 2023 when you're beginning construction, hopefully on the residential piece. Is that possible? Since I don't work for OFA, I don't know whether they'll allow that or not, if you want to leverage these dollars for an OFA project.
Well, when you deal with OFA, the two components of this one project have to be totally and completely separate. And Councilwoman, we've known each other for a long time. I think in Circle East, in East Cleveland, we walked on the land in June of 2011 and we broke ground prior to February of 2012. Anything is possible. Is it likely? No, it is not likely. I don't want to mislead anyone. But knowing the importance of this, we will focus on it. But I don't want to make a carte blanche statement and then Cheryl have you yell at me at the end of 22.
I wouldn't yell.
Hopefully in your new job, that would even be worse.
Are you hoping, you don't vote in Ohio, do you, Wes?
I could move. No, I do not. Actually, I
Let's
think
get
they
back
need
to
my
the
vote.
focus of political.
I was just hoping to see if we could get the treatment unit sooner, that's all.
We will work on it, Councilwoman. I just can't, I don't want to promise it, something I don't know if I can deliver.
Okay, thank you.
Any other questions in regards to the Hitchcock Center? There may be a few from Councilwoman Baker. She was unable to make it today. I did give her the option to email me prior so I could ask them for her, but I'm sure she's swamped and she didn't get a chance to do that. Is there anything else you'd like to share in regards to this project that we do not know? Jason?
Nope, just a thank you. Thank you so much.
Madam Chair, may I make a comment? Another
Yes.
Question.
Councilwoman Turner.
So good afternoon, everyone. I'm the rookie of this all-star team. And I would be remiss if I did not acknowledge the fact that I belong to the greatest sorority in the world, Delta Sigma Theta Sorority Incorporated. And I was so pleased to see 3 members of our organization present here today. And so my soror, Vicki Johnson, is sitting in the audience. I mean, she obviously knows a lot about community uplift, and I'm just so impressed by your organization's personal commitment to this process. I was on the job 3 days, and I think Councilman Conwell was like, let me tell you about the Hitchcock Center. And so we ate grits last week, and we talked about this in depth. So I absolutely love this concept. You have my support, and I just wanted to thank you for bringing this to my attention. I absolutely am a supporter of women in this issue, and I can see it being a countywide asset. So, thank you.
Thank you so much.
Thank you very much. We appreciate
Thank
everything
you,
you've done.
gentlemen, for coming. I'm glad we could save you from the bad weather we hope we don't get today.
That I even appreciate more. Thank you.
All right.
Thank you.
Thank you.
Okay, take care.
And I just want to say, Ms. Lou,
Your microphone.
staunch supporter of women and issues, please take this under your advisement and do what you can out there in the community. We need you on this. All right. Any other thing good for the whole? Nope. And we've ended on time, which I was really nervous about. This meeting is adjourned.